Okay, so these are helpful contact websites and then phone numbers. The So you'll hear me say CADA for an acronym for the Kentucky Health Departments Association. So that first website is the CADA website, and that link in particular is going to take you to um, just the homepage of the Health Departments Association. But at the top of that page, you'll see AmeriCorps, and you can click there. You have all been to that page because that's where you submitted your application for your AmeriCorps application, and then your IDs so that we can run your background check. So you've been to that site before, but it'll look a little different now because we've updated. Um, you're having a hard time. Tell me, sorry, y'all. I want to make sure that you're seeing the right screen. Is everybody seeing a large screen or a small screen?
Large screen. Yeah,
Okay.
I'm seeing a large screen.
Okay. Cairo, I don't know how to fix that for you. Um, Cairo, I'll tell you what, why don't you exit and then come back in and see if that's helpful. Thank you, Savannah. Do you see, is that helpful for you? We'll give it just a second to, okay. All right. Awesome. Thank you all. Okay. So the second one there, the second link is America Learns Timekeeping, which we'll get into that a little bit more in depth when we go over the timekeeping system. The myamericorps.gov is where you're going to access your education award at the end of the service year. So you're not going to really mess with that account much until we get to the end of your service. So I'll make sure that you have that link. The one thing to remember about myAmeriCorps.gov is for most things, I am your go-to to fix things. So America Learns timekeeping, your America Learns profile, I can fix those things. I can help you with if you're locked out. I can troubleshoot for you. MyAmeriCorps.gov, I cannot help you with that one. I can see your account, but I can't change anything in that account. I can't help you with your password. And it's for good reason. I mean, that's something that needs to have some separation. So if you ever get locked out of your MyAmeriCorps.gov account, you have to reach out directly to them. There is the phone number there. And then at the myAmeriCorps.gov website, there's also a way that you can submit a help desk ticket via email, but that's the only way that you can get assistance. I cannot help you with that one. Um, but if you are not hearing back, or if you're like, I've tried these things and I'm not getting help, then do let me know so that we can try to troubleshoot together if for some reason you're just not getting anywhere with trying to get something reset. My email address is there. And then the 502 number is the my Cato work number, but you have my cell phone number. That's my personal number. Go ahead and take your phone out and put those numbers in your phone because there might be something that happens like over the weekend, and you just need to like shoot me a text and say something, is going to prevent me from being at my site for the next week or something awful is going to happen. I don't know. I hope that doesn't happen, but don't feel like you can't reach out to me in the evenings or weekends. You're not going to bother me. That's what I'm here for, is to support you in any way I can. I don't want to make you feel like I am the only person you need to reach out to. You do also need to make sure you're letting your direct site supervisor know. If there's anything happening with your schedule or something that's going to prevent you from being there, you need to let them know too. But let me know as well. We both need to be in communication with you about anything that's going on. That link that says schedule a meeting with me, you can click that and it will allow you to select a time that I don't have something else going on, like on my calendar. It talks to my calendar and will only let you select a time to either do a phone call or a Zoom. If you want to have kind of a more formal meeting with me about something that's going on, or you just want to check in to make sure that you're on the right track with your time or with your duties or whatever the case may be. That's a good way to do that. That link is live, so when I send out these slides, you can definitely click it. And then that's the same link that's in my email signature, so it's all the same. Any issues or questions that anything on here that you feel like is not included or something that I've missed here? And also, if you text me, just reminder, to tell me who you are when you text so that I've got your phone number. Um, Email etiquette. So we will talk more about branding as we go on today and tomorrow, but um, your email signature should include something about AmeriCorps. So we are big on AmeriCorps branding and AmeriCorps programs. So something like one of these is what your email signature should look like. So um, I don't I don't think I've gotten a lot of emails from you all yet, and I wouldn't expect that in the first week. But if your service site or your supervisor has already gone over with you or set up your email, and they haven't said anything about including your AmeriCorps signature, that's okay. I will remind them about what your signature should look like, but it should look like one or the other. It's totally fine to include, you want to include your health department as well, but we want you to acknowledge that you are an AmeriCorps member. So either one of these or some version of these is fine. Um, if you want to totally copy one of these, that's great. Please do. But if you are having um, any issues with like your site supervisor not wanting to include this, please let me know, and I'll clear that up as best I can. Calendar of events. So this is on the CADA website under the AmeriCorps tab at the top, and it's going to be at the very bottom of the page. So for September, this is all that I have scheduled for you is our member training. So we did that quick check-in last week, and then we've got member training today and tomorrow. And then hopefully what you're getting at your site is site-specific training. So our Louisville member is doing something that I would not be able to provide training in or about because I don't have that knowledge. So that is training that Guinevere is going to have at her health department at her service site. For our harm reduction folks, I don't necessarily have the tools and the knowledge to provide that specific training. So you're going to get that at your health department. So hopefully you're getting that here in the first few weeks of your service. So I would expect your timesheets to reflect a lot of training. Um, and then we're going to get into October where there is our first opportunity for our community health worker training. And you've not missed anything. You haven't received any additional information here, but there will be some more coming from our trainers that are providing that training, and that's a virtual training. And then there is a training put on by our Serve Kentucky State Service Commission at the end of October, and that's just a 1 day, not even a full day training that they'll put on for us. So I've also got on here days that you have off for holidays. And a lot of times these are also the same days that the health departments are closed in observance of holidays. If there is one that's not overlapped, just You can let the health department know that I don't have to serve this day, but you can also choose to serve if you want to. If your health department's open on one of these days and you want to catch up on some hours, you can definitely serve. It's your choice. These are just days that your member service agreement says that you are able to take off. Um, I think the only thing I want to make sure we point out are some of these dates that are to be determined. AmeriCorps Week is in March. There's nothing that you have to go and do. Some of it might just be if you're a returning member, you might remember last year that we asked you to take some pictures for us as participating in AmeriCorps Week. A lot of it is just acknowledgement that you are an AmeriCorps member in our program. And then June or July could be our end of year celebration. So training dates are always subject to change. We know that we'll have an additional community health worker training as we get through the fall and into the winter. So look for that to be updated. Any questions about the calendar? Um, want to make sure that our language and pronunciation is correct. So AmeriCorps is AmeriCorps, like Marine Corps or core of an apple. It's not AmeriCorps. As you are talking with folks about what you do as an AmeriCorps member, just remember that you are a living being and not a zombie monster AmeriCorps person. If you can't remember it, I think the easiest way really is like Marine Corps. You're a member of AmeriCorps. Um, this sometimes it's just hard to remember, but hopefully this little graphic will help you think about how to pronounce AmeriCorps correctly. I think we've got time for one more slide before our guest. Oh, no, sorry, we've got 15 more minutes. We got some time. All right, so Kentucky Public Health AmeriCorps supports the core public health services. So that's going to be WIC, the Supplemental Nutrition Program for eligible women and children up to age 5, HANDS, which is a home visitation program to promote safe, healthy children, harm reduction, practices that aim to reduce the risk and harms associated with substance use, and health education and outreach, which is promoting public health programs. That one's really broad. So for some of you that were saying, I might be doing this, chances are you are. Really, the health education outreach component is a piece of all of those programs with CANS and harm reduction. When you're out in the community and you're sharing information about the services that your health department provides, you're providing health education and outreach. So these are the components of our Kentucky Public Health AmeriCorps program. AmeriCorps as a whole is a national service program that provides thousands of Americans with an opportunity to give back to their communities. So, AmeriCorps values. You'll see if you follow any like AmeriCorps social media pages, you'll probably see some of these things hashtagged a lot. Getting things done, strengthening communities, encouraging responsibility, and expanding opportunity. And I don't want to just like read off of a slide here because I think that these are really helpful and really important aspects and values, obviously, of the AmeriCorps program. And I'm hopeful that you're taking these away and really investing in them, and that these values are in turn kind of reinvesting in yourself as you're going through this year. I think that for me personally, when I did my year of AmeriCorps Vista service, it had a big enough impact on me that I have stayed in the nonprofit and public sector ever since, and it has been my career choice for my whole life. So this is the AmeriCorps pledge that we will say together as a group at the end of our training. So here's get ready for it. It's not too long, but we do like to say it together so that you feel connected to the AmeriCorps program. It's all about getting things done. So, get things done for America to make our people safer, smarter, and healthier, bring Americans together to strengthen our communities. Faced with apathy, I will take action. Faced with conflict, I will seek common ground. Faced with adversity, I will persevere. I will carry this commitment with me this year and beyond. I'm an AmeriCorps member and I will get things done. So, if you've heard about AmeriCorps before, then you may have heard about other branches. So, you are an AmeriCorps member, you are providing direct service. We are a state program. There are some programs that are national direct. We have a state commission, so there's a level that we go through. I had mentioned that I was a Vista member, so Vistas provide capacity building services. So think about development and fundraising and trying to bring capacity to a nonprofit organization so that they can continue to exist. NCCC is a um, those terms are usually a lot shorter. A lot of projects involve it's conservation corps. So if you have seen like after disasters and in preparation for disasters, NCCC will get deployed to certain areas of the country to help clean up or help clear trails in forests, things like that. So um, we are in the largest branch of AmeriCorps. There are about 75,000 positions each year, and members serve with more than 15,000 locations. There has been some cut with Federal AmeriCorps, but we are confident that we'll be back up to those high numbers as we move into 2026. So this is something that we find that is sometimes difficult for our non-AmeriCorps familiar folks to learn and to remember and to um, take forward into their sites, but hopefully you can help us share this information and be good stewards of it. So you are an AmeriCorps member. You're not an employee. You're not a worker. You're not a volunteer. You're not an intern. You're an AmeriCorps member. You are providing service at your service site. So your health department is your service site. It's not your job. It's not your employment. It's not your work site. Your position description, which you sign in your America Learns account, details the things that you do in your day-to-day schedule, your week-to-week. This year of providing service is in your position description, not your job description. You're paid a living allowance. It's not a salary, it's not a wage, it's not a stipend, and hopefully. This is information that you have already received, and this isn't new information as we're talking about it today. But if you have any questions, please let me know. And again, I think that this is just sometimes new information for our folks that have never heard of AmeriCorps, and even for our site supervisors and folks that you're in contact with at the health department at your service site. It's hard to make that change from a staff person to an AmeriCorps member. So we just talked about who benefits from AmeriCorps, and there are so many different programs that there's so many different populations that do benefit from it. Youth, seniors, vulnerable populations. AmeriCorps programs are wide-ranging because they're providing tutoring, mentoring, healthcare, housing. So in turn, those populations mean that communities and organizations are benefiting, and hopefully you as a member are benefiting from learning, providing leadership, getting career skills, you're earning money for college, and just becoming more civically minded as you complete your term. So, just to give you an idea of when AmeriCorps started, when National Service started, the VISTA program started first. Then AmeriCorps Senior and Triple C was created. Then AmeriCorps, the agency forms, and the first class of AmeriCorps members came through in 94. So it's been around for a long time. There are more AmeriCorps alum than you might think. Hate that it's a well-kept secret, but you might run into more folks than you know that are alum of AmeriCorps. Um, I'll share a quick story. My old man dog gets acupuncture every 3 weeks, and his vet and I were talking about work, and she said, "Oh, yeah, I'm an AmeriCorps alum too." So you never know who you might encounter that has completed a term of AmeriCorps service. So here are kind of the broad categories of what AmeriCorps programs are doing these days. And this will kind of ebb and flow based on what the needs of our communities nationwide are. Education, environment, housing, and health. So you're going to encounter other programs when we do that training towards the end of October that are providing services within these four categories. So, a lot of our programs in Kentucky are providing services within the education department area. Then we've got a few that are doing service within, conservation, disaster response, disaster prep, which I think will continue to get bolstered as we see more and more natural disasters happen across the country. Then we've got a statewide housing program and our Homes for All program that works to combat homelessness and get folks housed permanently. And then we've got a couple of health-focused programs. Our program and another program that do a couple different things. Actually, we've got three health-focused programs. So these are the main categories that we have in our Kentucky area AmeriCorps. Just some fast facts about AmeriCorps if you were interested in seeing the impact that happens nationwide. And then in Kentucky. So these are from a couple of years ago, the number of hours that were served by members, the number of volunteers managed, the number of members that we had in the state, the number of veterans served, and that last statistic about individuals transitioned into affordable housing. And then here's a graphic that was put together most recently about the number of sites that were served. So, health departments would be included in this site, the number of hours members served in our communities. I know this graphic's kind of small, sorry. The number of dollars leveraged. Um, excuse me. There were almost 70,000 children and youth served, the number of pounds of food distributed, uh, students with improved academic engagement. So these are all just numbers from Kentucky. These are showing that our AmeriCorps members that are providing service to Kentucky organizations, Kentucky families, Kentucky communities are making a big impact. So we know that these impacts are felt in our state, and there are programs in other states around the country. So we make a difference in our local communities and our Commonwealth, and we know that members are making a difference across the nation. So I've mentioned Serve Kentucky. We have, they're a great resource for us. They are a support system. So they are our state service commission. They oversee our annual grant competition that awards funding to our local programs. Um, so what they're doing is they're looking to see what the social needs are across the Commonwealth. They set policy and program priorities. And then they provide our training and program assistance. So when I mentioned that training at the end of October, They are looking for speakers and determining the needs of our programs to see what is going to best benefit our members and how they can best serve our programs. So that box at the bottom kind of walks you through the hierarchy of AmeriCorps in Kentucky. So um, maybe hierarchy is not the best word, but it's just the from the bottom to the top of kind of who we have to go through. So we are the local program. The Kentucky Public Health AmeriCorps program is at the bottom, I guess. And then we have the Kentucky Health Departments Associations where we host our grant, and then Serve Kentucky is the State Service Commission, and then we have the Federal AmeriCorps Agency. So, I think that's a good place to pause. Our guest speaker is joining, so I'm going to let her in, and we're going to transition over to our harm reduction presentation. Hi, Joanne.
Good
Good
morning.
morning. I'm going to stop sharing because I'm assuming that you have a presentation to share. Is that right?
Yes, I
Okay.
do.
All right. I just we were at a good stopping place. So I've just stopped my just paused. So I'll introduce you or you can introduce yourself. Everybody, this is Joanne. Some people know you. You see some familiar faces, I'm sure. Joanne is with the Kentucky River District Health Department, and she's gracious enough to join us to share about harm reduction. And I'll let you kind of take it from there. You tell everybody what you want to tell them, and
All right. I'm trying to figure out to share my screen and then we'll do one obstacle at a time. Okay, let's see. I think I've got it. Can you all see that?
yes, I can.
Yes.
Okay, wonderful. All right. Well, I'm so happy to see everybody on here today. I do know several on here. Yay. Okay, well, Whitney, do you want me to just go ahead and get started?
Yeah, I think so. Yeah.
All right. And please, everybody, I would like for this training to be as interactive as possible. So, whenever I will be asking a few questions, please just unmute and speak out, okay? I want this to be as open as possible. And if there's questions, that's what I'm here for, to help answer them. And um, so please don't be afraid to just to speak up, okay? All right. Like Whitney said, my name is Joanne Fraley. I am the Harm Reduction Program Manager and the Hub Director. I don't know if all of you all have heard about the Hub or not. Um, we are with the Kentucky River District Health Department. The Hub is the harm reduction branch of the health department. So whenever I say that, it is everything that meets the needs of our people that are suffering from substance use disorder. And as new AmeriCorps members, you're stepping into an important role with serving your community. One of the approaches that I'm sure Whitney has already mentioned to you is harm reduction, and some of you may even be engaging in that program. Today, I want to share what harm reduction is, why it matters, and how you can play a role in supporting it. So before we dive in, when you hear the phrase harm reduction, what comes to mind in just a word or two? Anybody want to throw some words out there?
Trying to stay safe.
Very good.
Needle exchange.
Yes. Harm reduction is a public health approach designed to meet people where they are. It focuses on reducing the negative consequences of certain behaviors like substance use disorder without judgment. The key here is dignity and compassion. It's not about requiring someone to be ready for recovery. It's about helping them stay safe and healthy and connected until they're ready. And oftentimes, whenever I first started in the harm reduction field, needle exchange was the only thing that it was known as. And that is a stigma that a lot of communities still hold on to, and we're working very hard to combat that. So why does harm reduction matter? It saves lives. Programs that distribute naloxone, Narcan have prevented thousands of overdoses. Syringe exchange programs reduce HIV and hepatitis C infections. But beyond the numbers, harm reduction builds trust. Many people avoid traditional services because of stigma. Harm reduction creates a safe entry point that can eventually lead to treatment, housing, and employment. And each of you that is going to be engaging in this program, you all, my most favorite place to be is in that syringe exchange room, because that is where it's real, and that is where you can assess and address the barriers that our people are facing. That is where lives change. All right. Core practices. Some common harm reduction practices include distributing naloxone and overdose training, syringe exchange services to prevent diseases. We also meet basic needs like food, hygiene, and transportation. And always practicing non-judgmental listening and motivational interviewing. So this would be a good activity whenever you all, I know you all are already engaging in the health department, and I'm not sure, every syringe exchange program, every harm reduction program looks different. I've served 7 counties, and each of my 7 counties look different, okay? But one thing is the same. Our people that come in to see us, they have needs that we can address, okay? So if your syringe exchange program or your harm reduction program is not making those linkages to care, I want to encourage you to take the initiative to expand those services, okay? This is where you need to know your community and know where the food banks are, know where the housing applications are. Go ahead and start gathering up some of these things. And I'm not sure how many of you all come with lived experience, but lived experience is so important, especially right here where you know exactly what is needed. So I want to encourage you to, if there's only interactions of exchanging the syringes, please expand those services, okay? Any questions so far? Whitney, you've got a quiet bunch today, don't you?
I know. It's they're just absorbing all the information.
Okay, well, we'll keep going. Okay, so how many of you all think there's a lot of misconceptions out there drifting around in your community? Well, you are going to be front lines on addressing those misconceptions, okay? And the way that we do this is we provide education and we highlight successes. And because there's so many things that people just don't understand what we do. I had a gentleman from Owen County, judge executive, came down to tour the hub a couple of weeks ago, and they're wanting to replicate the hub model. And we got into the syringe exchange room, and he's like, I really have a hard time with this service. And it took a conversation. It was, it's not just individuals bringing their dirty syringes in and us just tossing them out some new ones. It's that interaction. It's that having that one-on-one conversation that we're pouring into them where they don't feel so stuck where they are. And we're empowering them with hope that if they want to do something different, we can help them do that. So one of the biggest myths in the harm reduction, we enable drug use. So, and that has been said to me that, you're just handing out syringes to people so they can do their drugs. And it's also been said to me about Narcan. Whenever I was doing the Narcan training up at the schools, they said that we don't want to have a Narcan training because that means people's going to bring drugs to school. So I said, you already got drugs in your school likely, so you probably should have some Narcan just in case, so many misconceptions. The truth is it reduces the risk and it creates opportunities for change. Another misconception is that it's the same for everyone. In reality, harm reduction is individualized. It honors anonymity and it recognizes that every journey is unique. So that is one key thing I want each of you to take away. Everybody's journey is different. And recovery, yes, we would love for everybody that walks through our doors to go into treatment, okay? Because we know that, they've got so much, we can see the potential, but it's very important that we do not shove recovery down their throat. We want to encourage and empower, but we also want to keep them safe right where they are. And if they're not ready, they're not ready. And we're going to love them right where they are until they are. Okay? Any questions? So now we're going to be turning values into action. Okay? Harm reduction is rooted in empowerment and equity. We honor lived experience as wisdom. And we address systematic barriers like poverty, stigma, incarceration, and transportation. When harm reduction is in place, families reunite. Recidivism decreases and communities thrive. An example of this, the other day in Lee County, I'm in Lee County and this is my hometown, and this was one of the hardest communities to have the conversation. And probably about 6 or 7 years ago, whenever I first started engaging in the community, there was no drug issues here. Nobody's family had a substance use issue, and it was just like the whole community was in denial. And the other day, I went to our fiscal court meeting, and I was trying to access some of our local abatement funding to help with some barrier relief. Which this is something that, as long as Whitney's okay with, you all could be that voice in the community. And help, and that will help support expansion of services within harm reduction. But I was sitting there, and whenever, like we talked about a while ago, whenever you hear harm reduction, a lot of people only hear syringe exchange, okay? And that's it. So I'm always prepared to answer that comment of, well, I found a dirty needle in the park. because it's always, someone's always finding a dirty syringe, and it's always our fault. That's, I'm always prepared for that. You need to be as well if you're working in harm reduction, the proper ways on handling those situations. But there was absolutely no pushback. It was the most beautiful experience that I've had in my community so far. I've sat there with all of our local officials at the fiscal court meeting, and they raved on the impact that the hub is having, that harm reduction is having. And they can see the change within the community. They can see people that were once so broken and deep in substance use disorder. And now they are employed, and they have homes, and they can see that. So that changes the stigma in your communities. Okay. So be brave and be bold in your roles in harm reduction. So, and Whitney, I have blown through. You gave me an hour, and I've probably done it in 7 minutes, and I'm sorry, but
That's okay.
we'll kind of open it up afterwards, and we'll do questions and stuff if that's okay. So some key takeaways for you all is be approachable and non-judgmental. Your role is the very first step in someone's healing. So you need to know that the smile on your face. Be very cautious of your nonverbal. And I cannot go on about how important sitting in that chair is and providing these services to our people that's in need. Listen first and advise second. Oftentimes we get so caught up in fixing. And I am a fixer. It is deep in my core. If there is a problem, there's a solution, and I'm going to find it. Okay. If there's a crisis, I'm going to throw myself right in the middle of it, because that's what I do. It took me a very long time, an embarrassing amount of long time actually, before I learned how to listen to hear and not listen to respond. Whenever, and I want to challenge each of you all to maybe do some self-reflection and notice whenever you're listening to someone speak. If you already have a response before the person in front of you is done talking, you are listening to respond. Whenever you listen and you're totally focused on whatever is being said in front of you, and then you pause for a minute, not only is it validating to the person that is talking that you're listening, but they feel heard. And that sometimes that is all that they need. So with lived experience, a lot of times this is where, whenever we advise second, if you feel in your gut that providing that level of connection, then I will encourage you to use it. A lot of times people connect better whenever they think the person sitting in front of them have been there and done that. So please pay attention to your listening skills. And also recognize the small wins, okay? And if anybody is new to harm reduction and new to providing clean supplies for youth, this is something that was new to me whenever I first came into harm reduction. And you may get a participant in there that comes in with 800 syringes used. We're a 1-for-1, so we're going to give 800 back. But sometimes they'll try to wean themselves. And whenever they come in the next time and they've got 400 used syringes, then we need to celebrate that, because that's progress, okay? Because you never know. The next time they come in, they may only have 100. And I know those are big numbers, but I want you to be prepared what you could see, okay? Be sure that you're assessing their barriers, because it's not just about getting the clean supplies, okay? It's being their person. And if they're struggling with, if they're hungry, do you know the only barrier that they are going to know that they have at that moment? They're hungry, okay? There is lots of programs in your community, and if there's not, please reach out to me, because we'll find them, that can help with IDs. They can help maybe with hygiene supplies. If your harm reduction program does not have these supplies, we will find a way to get them, okay? But just having that helping hand, some people's burnt all their bridges and they have nobody to help them get an ID, or nobody to help them get them to the doctor. They may be suffering from a physical health issue. They may be walking around with the diabetes and not even know it. So see the whole person whenever they're sitting in front of you. And showing up consistently is so very powerful, okay? They're going to push your boundaries. I'm a boundary pusher by nature, so I don't expect anybody to be any different than me. And I know whenever I've got someone in front of me, I'm going to see what all I can get by with. It's not anything I'm proud of, but I'm old enough to accept my character flaws now. But being consistent with your people, let them know that they can trust you. And because the stigma goes on both ends. Our individuals that we work with has been let down by every system there is, almost. Be that one system that does not fail them, okay? And there's going to be things sometimes that we may not be able to help with it, but there's so many things that we can, even given a pair of socks. I will never forget the first pair of socks that I gave out. And I will never forget how happy this individual was that they got tears in their eyes to get a new pair of socks. So please see their person, okay? Think systems. Harm reduction is not only about individuals that are suffering. It is also about working in your community, and this, and I'm sure Whitney will absolutely be like, get out in your communities and help and bring communities together. But this is so important to think outside the box of just the syringe exchange, because harm reduction, reducing harm, is so broad, okay? You have so many barriers that people face that can cause detrimental harm. Think like that, okay? Because not all people that use drugs inject drugs. And sometimes our harm reduction programs only do safe use kits. There's also, safe sex kits, safe smoking. I mean, this is an opportunity to educate not only your individuals that you're working with, but your community as well. And here's some of our people. And not only is AmeriCorps so very important, but this the picture on the right here, um, that is a community. We were getting a big, huge, well, I think the big, huge semi truck was there, and it was full of donations. And the whole community pulled together um, to unload the truck. And it was such a beautiful moment of the community pulling together. Um, our members have changed throughout the years. Several of our members are now full-time Kentucky River District staff. Um, when opportunities open up AmeriCorps, your role, you're already building your position. Expand the services where you're needed. Okay? This is how harm reduction grows. You all are expanding the services as we speak on what and the reach that we're able to make and reaching the people that we need to reach. That's all that I have.
Thank you, Joanne.
Yeah,
Um,
learn do that in 20 minutes, girl. That's
that's
like
great.
record time.
We're gonna finish early today is what's gonna happen. So nobody's gonna be mad about that. Um, I think one
Well,
question,
yeah.
sorry, maybe this um popped into my head since we have some folks who are not necessarily going to be focusing on harm reduction, but are focusing on like WIC and hands, and maybe some other health education and outreach. Do you have any like words of advice or things to look out for if somebody is connecting with folks in other programs, but they see maybe the person they're working with might have a like a family member, or maybe they themselves might benefit from some services within harm reduction. Is there anything you would, if somebody is coming into the health department to not seek out services within harm reduction, but within another program, is there anything you would, how would you go about that to connect them to harm reduction services?
Well, I would definitely encourage those that are going to be in different programs to always be assessing for barriers. Because even if you, like if you, for say, we work really closely with our hands program because they work with a lot of families that could benefit from some barrier relief. Um, it does not mean that they are actively using. Harm reduction doesn't. We reduce risk. And if you see a family that is struggling um, that could use the extra support, um, like our hubs, we have 12-step programs and we have all kinds of other mutual aid groups and courses. Everybody is recovering from something and everybody needs support. And that's just real. And it may not be drugs, it may be alcohol, it may be, maybe they have an addiction with gambling, or I maybe they're grieving. There is so many things that you can assess out there in the field where you can provide that linkage to care. Um, I would I want to encourage you to not put blinders on and only don't stay in your lane. Like I'm a lane crosser a lot of times with if I see a need, I'm going to address it or I'm going to try to provide that linkage where they feel heard and supported. So you may, if you're working hands or WIC, you may be working with some of the same clients that are utilizing the harm reduction program. Um, be supportive and not judgmental. Um, you may hear things that you don't want to hear and you do not know how to respond to, and that's okay. It's okay. Um, because some journeys look a lot different than the journey that you may have been on. I have heard stuff that I had no idea how to respond to. But just being that person that cares enough to listen, and you may be able to provide a warm handoff to someone that can help meet the need that they're addressing with you. So just be open minded. We're all in this together. No matter what program that you're in, we are all in it together, and it really does take us all to make a difference. Um, so if you see, like, if you're working in in the home with a hand family and you see something that's like, have a conversation. Get beefed up on your motivational interviewing skills. Um, those are always handy to have, no matter what program you're in. Um, get comfortable with what you're doing and what you're asking. So that would be my tip.
Thank you. Does anybody have questions? Anybody else have questions
Well,
or
if I could, Whitney, I would like to put a couple of mine on the spot.
yeah.
I would like to hear their experiences. As a new AmeriCorps, and then what it feels like now, because I've got all of mine are returning members. I would like to hear, at least from three of you, what the process has been like for you. And because you might be able to shine a light on something that I've not hit on. My experience being new on the front lines may have been different than yours. So, Craig, do you care to come off mute and share what you've experienced?
Um, you touched on it a little bit, but just opening the doors to somebody with a smile and a good morning, how can we help you? How's everything going? Can change their day dramatically. It's not just about the needle exchange or anything, but just every little thing that you do with clients affects their day, affects their life, and you can see the gratitude in their eyes 95% of the time. And when I first started, I didn't realize how much of an impact that we would have on everybody in the community, and it's just a great feeling. It's a great thing to be a part of.
Thank you, Craig. Catherine, Katie, would you care to share your experience?
So when I first started out, I was kind of nervous about everything because even though I have a substance use disorder experience in my background, um, I was never an drug user. So as far as like doing the exchange and stuff like that, I was really nervous and stuff. But after, working around clients and seeing that they're just like how I was, it was just a different type of drug. It doesn't make them any less than, it doesn't make them, everybody's equal. We all have had experiences with things like that, and just being able to help people and really make a difference is really empowering. Um, like when I first started at the Letcher County Hub last year, I met with an individual who at the time was on an ankle monitor and she was under house arrest, but she got permission to come to the hub to utilize our services and things like that. I actually assisted with getting her into treatment, and now she has two jobs. She has a car. She's seeing her son again. She got teeth not too long ago, so she's got her smile back, and just simple things that we take for granted every day, like having a job for people that didn't have any. It's it warms your heart seeing them being an active, community member again. And I just love being able to make a difference and helping people. And I'm excited now that I'm in a new county this year to hopefully help a different, community. I'm excited for everything that's coming, I guess I should say.
Katie is getting ready to expand into another hub in Knott County. So it's really exciting. She's going to have two hubs under her belt. Um, she may be my floater just to open hubs up. It's great. I'm so excited. Go
I
ahead.
also volunteered at the Lee County hub, so does that make
Yes,
it three instead of two?
you could have the most hub experience, Katie, rock starring it up over there.
I don't know about the most hub experience, but the most experience in different hubs,
Yeah,
yes.
yeah. Well, thank you, Katie, for everything that you do. And do I have I'll Cindy or Jessica? Which one is the most comfortable in sharing your experiences? We'll do one more. Cindy.
I'll do mine. It's Amber.
Oh, Amber, go ahead and put your video on, girl. There you are.
Um, I remember coming to the hub whenever I was in active addiction and like not having any hope and really didn't know like where to go to get it. And to be able to like work with people that is still using or on drugs and to be able to help them in ways that I got help, like it's a blessing because I get to see like where I was and how I got help. And I like helping people that are stuck suffering.
Beautiful. So proud of you.
Thank you.
All right. Thank you all. Thank you guys for sharing. It means so much. And just the growth that I have been able to witness, it is so beautiful. I'm telling you. Um, any questions? Any questions for any of my staff? Or members, my bad, not staff. Sorry, Whitney. Ugh, I am better than what I used to be.
We just went
They're
over
all
that.
mine. They're all my people.
You corrected yourself though. See, that's the goal. So
Yeah.
you're perfect. Well, if anybody has questions afterwards, I'm sure we can reach back out.
I'm always available. And if any of you all want to fire up a hub, I now have a toolkit. So,
Don't threaten us with a good time, Joanne.
hey, listen, bring it. Bring it.
Well, thank you so much. I really appreciate you being here. And if you want to send us anything to send out, we've got some folks who couldn't join us for the training now, but we're recording so that they can catch up. But if there's anything you want to send us to send out to other folks, we'll do that. But
And
thank
if
you
there's
so much.
very welcome. If there's anything, Whitney, that I can do to help you, you just let me know, okay?
All right. Thank you.
All right, bye, you all. Everybody have a beautiful day. It's Monday.
It is.
Choose joy.
All right, y'all. Well, we are ahead of schedule. So I hope that that was helpful for our new folks who are coming in, and then also for even if you aren't participating in harm reduction this year, like Joanne said, we're not in a silo. Everything is interconnected, and serving in a health department, you're gonna have encounters with other programs and other staff and other folks who are accessing programs beyond what you are serving in. So if you think of something afterwards, please reach out either to your fellow AmeriCorps members or to me, and we can get you to somebody. If we don't have the answers, we can get them for you. So I'm going to go back to sharing my screen. And we have our next guest is at noon. So then I'm just going to keep on going until we get to that one. And I'm going to turn off my camera for just a little bit. Okay, I think we got through this one. So if, actually, I tell you what, y'all, do we want to take just a quick little break for y'all to maybe use the restroom or get a drink or something?
Yes, please. Like a smoke break would be great.
Okay. Okay, perfect. Let's come back in, let's say 7 minutes. So that'll be 11:28-ish. So come if we can come back at that time, then we'll get started again. I'll see y'all in a few. Okay, y'all. Hopefully most of us are back. I'm gonna keep on going and we'll just go as far as we can and we might just wrap up early today and see what happens. Okay. Let's see if we had, oh, sorry. Okay. All right, so I think we've gotten through this slide. Just a quick reminder again, it goes, I'll go from the top to the bottom. So at the top of the kind of food chain is our federal AmeriCorps agency, and then under them is Serve Kentucky, our state service commission, and then the Kentucky Health Departments Association that you might hear referred to as CADA is who is our, excuse me, our fiscal agent. That is where I work in Frankfurt at CADA, and then our program is the Kentucky Public Health AmeriCorps program. All right, the AmeriCorps logo, yay! It got rebranded just a couple years ago. So this is a relatively new-ish logo, and um, you'll hear like the day of the A, and the A represents hopefully brand recognition. So it is national service, passion, empathy, connection. It tells our national service story, and hopefully you see other folks wearing their AmeriCorps gear and you are easily recognized to other um, AmeriCorps members and AmeriCorps programs and AmeriCorps alumni. So this is why we want you to be recognizable. It shows that you are there to serve your community. It helps spread the mission of our program and what we're about. And hopefully it promotes unity among the members serving in a variety of ways. So these are a couple pictures of members in their gear, kind of working together to provide service at their sites and beyond. So you've got your gear, and we want you to wear it at your site. So we you should have at minimum a t-shirt, your jacket, a sweatshirt, buttons, name tag, lanyard. Um, you've got like a pin. Obviously, can't wear that. Um, but if there are additional things that your site creates, we would love to have the AmeriCorps logo on it. Now, don't expect, like, I know that some of your health departments provide you with like a t-shirt. I don't think they're not going to go back and add the AmeriCorps logo on it, so I get that. But if you are wearing like a health department provided shirt, stick your name tag or your AmeriCorps button on it and just keep it on there. That's great. We just want you to have something that shows that you're an AmeriCorps member on your person every day that you're at your service site. So we're just big on AmeriCorps gear. If you're catching like any kind of question from your site supervisor, from other staff at the health department, let me know. I'm happy to just kind of share with them. This is a big part of our program. We want our members to show some gear every day that you are providing service. While we are on this slide, has anybody had any issues with receiving their updated gear this year if you're a returning member, or your new gear if you are a new member? Silence is golden to me in this at this point. So if I'm not hearing anything, I'm assuming that you've received your stuff. Okay. Um, if you have any issues with like a size that's not working for you, please reach out to me. We can always, I can send you a better size and then pick up um, whatever, size didn't work, we can exchange something. So just reach out to me, let me know. So I think we've already said this, but doesn't hurt to say it again. We're proud to be AmeriCorps members, AmeriCorps programs, because we're making a difference in our community, creating movement, and developing our communities to be stronger. So within here's, I think, in Kentucky Public Health AmeriCorps, what we're doing, where we're providing service, how we're providing service. So if you're kind of a big picture person, then maybe this is a good way to think about the service that you're doing this year. Um, you are part of an AmeriCorps state program. You're providing foundational public health services, and then you're also providing core public health services. You're working in local health, public health priorities, and you're providing advocacy and education within public health. So if you're curious about where members are located, um, I don't know. It's kind of hard to see on the updated map, but last year we had members in that smaller map in the upper left hand in the left hand side, and as you can see, this year we've expanded a little bit. Part of that expansion, I think, is kind of due to the Barren River District is a district health department, and that's over there in Warren County, Bowling Green. So that district health department covers quite a few counties over there. So we are able to kind of pick up a good chunk over there. We've added Grayson County as a site, but then we also lost a few counties this year as well. We don't have a member in Graves County or Mercer County this year. So it's gonna, our program will ebb and flow based on health department needs. But if you are somebody who wants to reach out and see how things are going out in Marshall County, then, or Western Kentucky, and you're like, oh, we've got a member in Marshall County, then you can reach out and see what's going on out there. So, um, or if you are, in Eastern Kentucky and you're looking at the map and you're like, oh, I can connect with my neighbor in Johnson County, then that might be helpful to know. So, how do you make the most of your service? So, I think that maybe what you've been hearing up to now is a lot about how to be successful, and it has been an emphasis on completing your hours and here's what you got to do to get done. And that's important, but it's also maybe we haven't talked a lot about how to, as you're in the moment, think about the new opportunities and new skills that you are going to be to have available to you, and how you're going to be out of your comfort zone sometimes. If you're somebody who's a little bit introverted, that you might have a lot of chance to be extroverted as you are out in the community and learning new things and new skills and interacting with folks that you may not have interacted with before. I think that just like with anything, you get out what you put in. This is an essential service that you're providing to your community and community members, and you are going to be playing a vital role in providing those services. You're going to be depended on by both your site and the people that you are providing service to. So just try to remember to be present and to give it your best effort. That's not to say that you are, responsible for the, total success of your project or the success of somebody, a community member, getting into a program or having service provided to them. But if we're listening to Craig and Amber and Katie, they shared how what they were doing was impactful for the folks that they were serving. So you can definitely have a big part of somebody's success throughout this year. So then back to the hours. If you do complete all your hours, then that is definitely a successful year and you do earn your education award. So, as an AmeriCorps alumni, you are opening up connections in your community, and we know that through some longitudinal studies that we see that those connections can lead to public service careers, and I think that as we look at folks who are employed in the public service sector, that more people than we think are AmeriCorps alum. So it is great to be able to put on your resume. You're getting opportunities that you may not have had otherwise. So it's like I said, sharing my story about connecting with somebody who I didn't expect to be an AmeriCorps alum within my vet. There are lots of AmeriCorps alum out there, and you can connect with them as you complete your service year. So we suggest that you be present, ask questions, and connect as you go through the service year. And here are some ways to do that. I know that that's not a YouTube graphic. I forgot to change it, so I apologize there. But these are our social media um, channels. You can go to our Facebook page and like our Facebook page and our Instagram page. And for our returning members that may have been here when we had a previous program director, these are new social media pages. So unfortunately, we couldn't get access to the Facebook and Instagram pages that existed before for the Kentucky Public Health AmeriCorps page. So these are brand new pages. So if you were to go to either Facebook or Instagram and search Kentucky Public Health AmeriCorps, unfortunately, there's going to be two pages that pop up. So um, the pages, if you search by that backslash the KYPHAC, you're going to go to the right one, and there's only one post on there. This is welcome to the new page, and then the cover photo is a collage. So if you are having any issues finding our new social media pages, reach out to me, but I'll send the direct links in our follow-up email after we do our training. The YouTube page is brand new. There was not a um, page before this year. Okay, y'all. We're gonna do just a really quick, since we're I think this will be helpful for us since we are virtual. It's hard to get to know folks when we're not together in person. So, oh, Instagram's not showing up. Okay. I'll make sure hopefully it's public. Thanks for telling me, Lily. I'll look into that. So just a quick little sharing about us. What do you like? What are you looking forward to? What do you dislike? Something you're committed to, and a fun fact about yourself. I'm happy to go first, and then I might just call on folks again. Um, this can be really informal. It doesn't have to be anything major. Doesn't have to get too deep if you don't want it to, or you can make it deep. Totally up to you all. So what do I like? I really love that it is cooler weather. I'm gonna go with that. What am I looking forward to? I'm looking forward to Halloween. I love Halloween and fall and decorations and getting out my decorations. What do I dislike? I'm gonna keep it a little bit light, and I'm really disliking that I take 64 to and from Lexington to Frankfurt, and right now it's down to one lane right before you get to Frankfurt, and I'm really disliking that right now. Something I'm committed to is making this program the best it can be and providing whatever assistance I can to our members and our sites. And a fun fact about myself. Oh goodness. I don't know. Um, a fun fact about myself. I collect carnival glass. I'll go with that. Okay, I'm gonna call on from the top this time. I'm gonna go with Alina, Cole, and Cairo.
Okay. Um, what do I like? Uh, I really like my service site and all my coworkers. I really like everything that I'm doing at my site. Um, I am looking forward to um, seeing what new responsibilities that I can take on this year. We're hoping to get me some um, more things. Um, what do I dislike? Um, I really dislike the weather switching back and forth. The hot days to cold days. I ugh, really dislike that. Um, something I'm committed to. Um, I'm very committed to public health resources and gathering resources for people in the community. And then a fun fact about me. Um, my favorite animal is a cow.
I guess what do I like? My favorite football team is the Ravens, although they lost last night. What am I looking forward to? Finally getting some hands-on experience. Just because I just graduated college and I was playing lacrosse, so it was kind of hard to get real world experience and hands-on experience, especially with public health. While I was in my undergrad. So I'm just excited about that. What do I dislike? I guess still going along the weather. I don't like whenever it's too hot, just because I hate whenever I'm getting into like a hot car whenever I have to drive somewhere. Something I'm committed to, I guess I would say fitness, because like I said, I played lacrosse, but now that that's over, I'm still trying to stay as active as I can, um, with the schedule that I have. And then a fun fact about myself was I went to Alaska last summer, and that was probably my favorite state I've ever visited.
Hello. Hi. I like so many things. I really love good music and meeting like-minded people in my community. Um, I am looking forward to further servicing my community and Healing Appalachia that's coming up next weekend. I dislike lavender and all the stigma and lack of empathy in my community surrounding harm reduction. And I'm committed. Recently, I've committed to tabling for the uh, Stay Project, which is helping young people want to stay in Appalachia and making it a place that we all want to live. And a fun fact about me is if I were a dipping sauce, I would be ranch because ranch is like universally loved.
That's a good one. I liked that one. Made me Google Cairo. Okay, next, Karan, Cindy, and Amber.
There you go. Hi, let's see. What do you like? Animals. Love animals. What am I looking forward to? Also breaking the stigmatism associated here with harm reduction and getting more information out there about exactly what harm reduction is. What do you dislike? Mean, judgmental people. Something you are committed to, helping as many people that I can. And let's see, fun fact about myself. Anytime I get full, whether it's food or drinks, I sneeze continuously.
Cindy and Amber, are y'all there?
They are helping a client.
Oh, okay. All right,
We'll be
thank
right
you.
back. You're
Okay.
welcome.
All right, we'll go to Craig, Guinevere, and Katie.
One of the things I like is helping the people in my community to overcome and succeed. What I'm looking forward to is graduating drug court. Something I dislike is glitter. I really hate glitter. Uh, Something I'm committed to is my sobriety. And a fun fact about me is I have 21 months clean and sober.
Um, so one thing I like is cooking. Um, One thing I'm looking forward to is completing my supervision for my LCSW. I still have like a year and 8 months, but I'm counting it down. Um, One thing I dislike is super hot weather, because I don't like every time I have to take my dog outside having to come back in and completely change because I'm sweaty. Um, say something that I'm committed to, say recently is like my time management. Because with this position in my current job, it makes my days really busy. And then a fun fact about myself, my I'll say like I graduated recently in May and I am a full-time therapist.
Um, okay, so I guess I like to color and do arts and crafts related things. Um, I'm looking forward to all the upcoming holidays like Halloween, Thanksgiving, and especially Christmas because that's my favorite holiday. Um, I dislike the drive to my new site. I'm driving about 55 minutes to my site and then 55 minutes home. So that's a lot different than 20 minutes to my site and 20 minutes home like I had last year. Um, as far as something I'm committed to my job and helping others. Um, and a fun fact about me is I have a almost 4-year old who has autism, and I just love her so much. She teaches me new things every day and definitely keeps me on my toes.
Thank you for sharing. Okay, Amber's back, so we'll do Amber, Latoya, and Lily.
Uh, what do I like? I like helping people and I like my job. What I'm looking forward to, another year with AmeriCorps and being able to help the community. What do I dislike? Um, I really don't, I don't know that one. Something that I'm committed to, my recovery and my job. And fun fact about myself, I'm getting my kids back.
Okay, let's see. What do I like? I like sushi. I'm looking forward to serving this year. And this will actually be my final year, being able to serve. What I dislike is traffic. Something I'm committed to is just serving the local community. And a fun fact about myself, I collect pop figures.
Um, I really like cats and coffee. I am looking forward to the community health worker training. It's one of the reasons why I really wanted to do AmeriCorps. I dislike spiders and also I-75 right now. Something I'm committed to is just gaining professional experience. I just graduated in May, so I'm really trying to gain that experience through AmeriCorps and through my health department. And a fun fact would be that I there's a Civil War grave on the property that I live on.
Okay, I think just the last couple. Regina and Savannah.
I like the fall colors. I'm looking forward to the holidays. I dislike taking the decorations down and changing my clothes backwards and forth from cool to warm. I'm committed to caring for my parents, and a fun fact is I'm also a hairstylist.
Something that I like is in my free time, I'm a studio artist and I really love painting and ceramics. Something I'm looking forward to is getting to know the needs of the Northern Kentucky community and learn from my coworkers at the health department. Something I dislike is that the temperature's going up and that it's going to be 80 degrees up here this week because I'm so ready for fall in the chilly weather. Something I'm committed to is learning more about public service. I just graduated undergrad and know that I would like to go have a career in public service. So I'm hoping that being an AmeriCorps member will provide me a stepping stone to doing that. And a fun fact about myself is 2 years ago, I did a study abroad course in the Netherlands that was focused on public health and public policy, and it was a really cool experience.
Okay, did I get it? Did anybody not get to go? Would you tell me if you didn't? Okay. Um, so we've just got a few minutes until our guest speaker is supposed to join us. Latoya, I'm gonna put you on the spot. Are you at the health department today?
Hold on a second. No, not today, but I will be there tomorrow.
Okay. I was just gonna, because Dave is our noon, he's our noon guest speaker. So I was just gonna see if you were there with him. We'll keep going until he joins us. So if we have to stop, we just have to stop. All right. Um, so this stuff should hopefully be, these are things that you've already seen. We are focused on providing service within WIC, CANS, harm reduction, and health education outreach. So the you can provide service in one or all four of the following. So I think it sounded like when we did our introductions this morning that most of you all are pretty much aware of what you're doing as far as your service goes, whether it's WIC, CANS, harm reduction, health education, and outreach, or a combination of those programs. That health education and outreach component, again, is pretty broad. So if you are sharing information with the community about programs at your health department, then that's health education and outreach. So that is a new component to our program this year. So if you were listening and you were thinking, well, I am not doing WIC, CANS, or harm reduction, but I'm providing service by sharing information about this other program that my health department is has going on, then it fits under health education and outreach. So don't feel like what you're doing is not part of the program just because it's not one of those other three kind of core public health programs. It is. It's just a little bit different. So if you ever have questions and you feel like you would like a little more guidance, and you need to reach out, please do. So we're getting into policies and procedures. Okay, we'll keep going. All right, our member service agreement. So this should be a review because if you're a new member this year, you received a copy before you accepted your term of service, and then all of you in your America Learns account, you have to sign the member service agreement so that you can start your service. Um, so we're just gonna make sure that there aren't any questions, any things that you're unsure about, please stop me and ask. Otherwise, we'll just keep going. So the member service agreement terms are going to include the terms, conditions, and rules of serving as an AmeriCorps member. So again, you've already signed it. We want to be clear that AmeriCorps is not employment. So if you were to end your service, then you cannot apply for unemployment compensation. And the MSA is in effect for the entire term of service. And I'm now going to pause because our guest speaker is here. So I'm going to stop sharing my screen. Hey, Dave. We just paused where we were so that we could welcome you in to do what you're going to do.
Sure. How's it going?
Good, good. Thank you for being here. We have had hopefully a good couple hours of training, so I will just introduce you, or if you want to tell folks who you are and what you're doing. Latoya's here, so she could also
Yeah,
join
absolutely.
in.
Yeah.
And
Yeah, cool, man. Well, thanks for having me. I appreciate it. So basically too, just to make sure you just want a good overview of like the hands program, right? And kind of
yeah,
what it is,
yeah,
what we do, all that good stuff.
yep,
Yeah, absolutely. And
yeah,
then like the awesome work that AmeriCorps is doing. Latoya's been helping us with our hands program here in Fayette County and all that good stuff, right?
yeah.
Cool. Okay. Well, I'm Dave Peterson. I'm the community programs manager here at the Lexington Fayette County Health Department in Lexington. Um, we are kind of a unique department for public health in that we are kind of what we call like a quasi-government agency here. We're a lot of the programs, including like the HANDS program that I'm going to talk about, are state initiatives and state-run programs, and so we're tasked with offering a lot of that kind of stuff. But then also we're locally governed by Board of Health here, so we're a large health department. We serve a county of about 450 some odd thousand people, so it's a pretty big health department, one of the bigger ones in the state. And so my job here is that I manage the community health division, which includes the hands department, and then also all of our community health education, outreach, the programs that are really out in the community providing public health education and support. That's all in our division. So yeah, I've been with the health department now for about 8 years. So I've been here for a while. So in looking and kind of thinking about what to talk about in terms of hands, I'll give a basic overview of the hands program, what the hands program is, who it serves, and just a little bit of broad stroke about the hands program, and then also to talk a lot about just in Fayette County, what we're doing with hands, and then in terms of AmeriCorps, how we've been using our AmeriCorps member uh, to help grow our program and to help, to make sure that those services are reaching the people that need them the most. Whitney, am I able to share my screen?
Yes, uh-huh.
Okay, perfect. Um, I've got a couple things. I've got a quick PowerPoint. Can you guys see this?
Yes.
Good. I've got a quick PowerPoint with some kind of, again, broad stroke information about the hands program, and then I've also got a video to show as well that is it's not super long. I think it's about 15 or 20 minutes long. Whitney, is that okay? But it's got it's a pretty, it can tell the story a lot better than I can tell the story, to be quite honest with you, because it's a video that was shot recently, just last year, here in Lexington. And we basically followed a few of our hands families. They're the ones featured in the video. The whole idea behind the video is to try to produce something that tells the story of hands, just what it is, and to try to help educate the public and try to drive more people to the program. So that's the whole concept behind the video. So I'd love to show that as well. That can tell the story a lot better than I can in a lot of ways. But the hands program, let's make sure I can. Yeah, cool. Okay, so what is HANDS as an acronym? It stands for Health, Access, Nurturing, Development, Services, which is a mouthful. Health, Access, Nurturing, Development, Services. I'll be honest with you, that's been the name of the program since its inception here 25 some odd years ago. We're one of the first states with a home visiting program like this. Most states have a program similar in nature to HANDS. HANDS is a unique program to Kentucky. It's a mouthful: Health, Access, Nurturing, Development, Services. That's why we call it HANDS. The thing I don't love about HANDS is that it's when and if you're out in the community and say, hey, have you ever heard of the HANDS program? Or would you be interested in this program? It doesn't really tell you what it is, you know what I mean? And so that's where, we're always, program promotion and program awareness is always a challenge for us. It's a great program, but it's one of those ones that requires a little bit of explanation. And the hands program, again, that's promotion's always a goal, and something that we struggle with to try to get the word out to the community most. But hands is Health, Access, Nurturing, Development Services. An overview of the program is that it's an evidence-based, as everything we do in public health is always evidence-based. In other words, it's based on data, it's based on research, it's based on proven outcomes. And we use a curriculum, standardized curriculum in Kentucky, so all the services are going to be consistent county to county. But it's an evidence-based, voluntary, statewide home visitation program. It's for pregnant women and women with infants. Okay. We promote and try to educate the public to, see an increase in healthy pregnancies and healthy births in Kentucky. We promote healthy growth and development in children and infants. The goals are also more far-reaching in helping to try to encourage and support, self-sustaining, self-sufficient families, create more safe homes, more stable homes for children to grow up in Kentucky. And in Lexington, we're kind of unique in that we actually have two providers of the HANDS program, the health department, and then also our partner, Family Care Center. And then the curriculum that we use is called Growing Great Kids. And again, that's not something that's local to Fayette County, but that's something that's statewide. Every county has a HANDS program through the health department, and every county uses that curriculum. It's evidence-based, and that speaks to, best practices in raising infants. Okay, so in a nutshell, the HANDS program we have here in our department in Fayette County, we've got 6 home visitors. They're social workers. What they're tasked with to do on the daily is basically they each have a caseload that they carry. A full caseload for a HANDS worker is usually anywhere between 15 and 20 families. Okay. They're seeing these families weekly in home visitation. We're actually going to the home of these families. You can enroll in the program as soon as you become pregnant, and that's honestly the best time to enroll in it because we have a whole lot of best practice guidance that we can give you when you're pregnant in terms of how to best nourish your baby in utero, what to expect being pregnant, how to baby proof your home, how to kind of prepare the soil, so to say. So for when your baby comes, it's at least you're equipped with some knowledge and some know-how, but you can enroll in the program up until your baby is 90 days old. So it's a small window that we have to capture these families. You can only enroll until your baby is 90 days old. After that, it's too late. Once in the program, we serve that family until the child ages out after age 2. So for the first 2 years of their life, we provide services to them. So that's a long time, and we're providing weekly home visit services. Once the children get close to aging out, once after that first year, then we go to like every other week when we visit them. But for the first year, we're visiting the families weekly, every week. We go to their home. A visit lasts anywhere between 30 minutes and an hour, but we strive for at least 45 minutes or more when we do visits. And we're essentially meeting the families where their needs are because every family is unique. Every child is unique and everybody has different needs and different questions. And so we're able to basically take the curriculum and answer whatever particular question you might have that week. It could be based on, is my baby developing properly? We're not sure. We're a little bit worried because they've been doing this. Is this normal? They're not eating this, but they're eating this. Is this okay? There's a lot of questions that you have. I mean, babies don't come with an instruction manual, and so it's kind of everybody who's a new parent can understand. There's a lot of that you don't know. And there's a lot of old guidance out there or a lot of, well, my grandma says, when it's time to put him to sleep, you should do this or whatever. And it's like, oh, that's actually not evidence-based and that's proven to be not the best practice. And so, that's where the home visitors can kind of help provide that support, right? And so that's what we're there to do. We're there to provide support. We're there not to tell them what they do wrong. On the flip side, we're there to go basically and encourage them and point out what they're doing well because everybody has their strengths and we try to see what theirs are and build on those, right? And so we're providing weekly home visits for the first couple of years of the child's life. And again, they can enroll as soon as they become pregnant up until the child is 90 days old. They do not need a provider referral to enroll in hands. You can self-refer. Okay. That said, we do have a lot of partners out in the community that provide us a lot of referrals. Local OBGYN's offices, Baptist Health, Latoya has been fantastic. Our AmeriCorps member has been fantastic to help connect with some of these providers and of other services to women who are expecting or new families and reach out to them and link them up with hands programming. That's a big a big challenge that we have is to keep people referring into the program so we can serve more people. So again, mothers and fathers may enroll prenatally and up until the baby's 90 days old, and then they can stay in until the baby's 2. We can take families both with that it's their first child. We call those core families or multigravida. Multigravida is a fancy word for saying you have more than one kid. We can take parents that have multiple children as well. That's kind of a change in hands. It used to when the hands program first rolled out, it was really for new parents. But then we started to find that honestly, there's families that have kids already that are having new babies that really could use the support and the guidance and the service. And so we were able to open that up to basically any family with a newborn. So you don't have to be a first-time parent, although it's certainly very helpful for first-time parents, but it's also helpful for families who already have kids. And we have both in the program. It's not a mandated program whatsoever. It's a totally voluntary program. It's not income-based. So the program is free. That's a really important attribute of the program. It's a free service. We do not charge the participants for hands. It's a free program for everybody. It's not income based, so we have people from all varying stratification of income level and everything like that in the program. You do have to qualify for the program, and the qualification is based on need, based on an assessment that we give. Okay, so if you indicate interest in the hands program, the first thing that happens is that one of our visitors will come out, one of our social workers, and they'll do a basic assessment. And if there are any kind of concerns, and financial concern is one of the things that can qualify you for hands. So financial limitations, barriers in that regard can certainly qualify you for hands. But also, we look at adverse childhood experiences of the parent. And adverse childhood experiences could be anything that may have something that happened in the past as an adult now that can speak to maybe putting, creating some sort of barrier, creating some sort of concern in the way that you might parent a child, or what you feel is appropriate, age appropriate, discipline appropriate, that sort of thing. Were you spanked as a child? What are your thoughts on that kind of thing? Are there substance abuse issues? Are there possible housing that issues, or are there any barriers that exist can qualify you for hands? And I always say that more people qualify than don't, to be quite honest with you. I mean, there are a lot of things that can certainly qualify you to receive hand services. The survey that we give you initially in itself is a service, because we're providing you also with information on connecting with other social supports, information on public health services, and all that sort of thing. So, I mean, the initial survey is a service in itself. But, most people will qualify for hands. And so then we can start to offer services. The hands program, again, it's absolutely free. The hands program is supported through Medicaid. So most of our, the visits that we do get billed, but they don't get billed to the participant taking the service. They get billed to Medicaid, or if the participant's not a Medicaid recipient, there are other monies that have been earmarked in the state to help support those families. And, the families, it's absolutely free to everybody. Okay. Again, it's evidence-based program that has a lot of proven outcomes. There's been a lot of demonstrated, positive outcomes in terms not just of the healthy growth and development of the baby, but in the family's self-sufficiency and the stability in the home. So again, it really helps to increase the likelihood of healthy growth and development of the baby, and helps to save on healthcare costs and other things down the road, both for the family and just for the community at large, because it helps to create strong, stable homes. Some really cool outcomes to share based on evidence and data. Complications during pregnancy are 40% less for hands families. And again, a lot of that is just because of the good guidance that we give you weekly on properly preparing yourself, physically and nourishing the baby in utero and all this sort of thing. It's very, very helpful, and definitely reduces the risks of complications during pregnancy. And then we also see a big mark is in healthy pregnancies is that we have 26% less risk for families to have babies prematurely when they're in their enhanced program. So that's another very key indicator on the quality of the curriculum that we offer and the quality of the service in terms of providing real results in improving the health of, the folks who are pregnant in the program. Low birth weight. Kentucky, unfortunately, a lot of is very high on the list of states of we have some of the biggest problems with low birth weight infants. And we're looking at a 46% less risk for parents who are in the hands program of having a low birth weight baby. Again, a lot of that is just because of the instruction that they receive when they're pregnant. And then we see a marked drop in child abuse and neglect of hands families, really close to half, 40%, 7% less risk than similar families who did not, participate in any sort of program like hands. So, those are some big key indicators and some really important key indicators on the quality of the program, the quality of the service that we're providing is very high quality service. And a lot of that is just it's a very intense service in terms of that personal connection that that family makes with the home visitor, right? They're going, you can imagine we're seeing these families weekly for an hour at a time or so. They get to know their home visitor very, very well. They get very, very connected. That visitor becomes a real important guide and providing counsel just on everything to do with raising their infant. Um, and so that's one of the coolest things about the program. And you know, a lot of our families that we serve here in Fayette County, and again, every county is going to be unique, but in Fayette County, we have a lot of refugee families that are here. We have a lot of Hispanic Latino families, migrant families, families that are here really uh, without any support. I mean, without any extended family in the area. A lot of times there's language barriers that are present. 100% of our home visiting staff are fluent bilingual Spanish speakers, so that we can work with that populations in in their preferred language. And then also we're able to work with, using translation services. We serve a large population of Kenya Rwandan families, Swahili families, just, I mean, a lot of different populations, really, when I think about it. It's really amazing the number of different cultures and families that we serve. And a lot of those families come here and they don't know anybody in Kentucky. This is, they're on their own. And so that home visitor becomes a really trusted companion, quickly, because they're a trusted adult who's offering good guidance for them. So yeah, it's great. We do some special events and things as well as it's not just one-on-one visitation with the families, but we do some special events throughout the year. We do like a trunk or treat. These are all hands families that are participating at the health department. Around in the spring, we do our extravaganza. I didn't come up with these clever names, by the way. My staff way smarter than me, so they come up with this stuff. But where we'll have, we'll have like the fire department come, or the Lexington Police Department or somebody will come, or just different agencies that help support and provide, a safe community for these families, and that way they can kind of interface and get to know people and get comfortable, and be aware of what else is out there for them. We have like a winter holiday party where we invite our families in, and it's really as the manager and everything. I'm a little bit removed sometimes. I mean, I do some shadow visits and things like that. I'm not a home visitor myself, but I'll observe, and like at the events especially, it's really amazing to see just the connection. I'm always struck by like the connection that the families have with the home visitor, because it's a really genuine like connection that they've got. That's one of the things that I think makes the program really special, is that. So before I play our video, which honestly to me probably tells a better story than I can. Are there any questions to this point? Cool. Okay, I am going to, I'm going to stop sharing for just a second and pull my video up. So this video tells a good story. A little bit of background about the video. It was made last year through some grant funding that we had for program promotion. And this is where this is where AmeriCorps comes in a little bit. And, the main thing that we task our AmeriCorps member with, Latoya, who's working in this program, who's brilliant, by the way, and I know she's on this. We love Latoya here. She's been a fantastic help to us. But is with program promotion. It's hard. It's a hard program to promote because, it's home visitation for infants is just a hard, it's one of those things that we always need help promoting. And it's something that in hands, once families reach that 2-year mark, they graduate out. And so we're constantly, every month, we're losing families because of graduations or attrition or something. And so we're constantly having to try to get new referrals to the table so that we can keep, the program, we can keep serving the population and hopefully growing the population that we're serving. Right now, we've got about 75 families in the program. And that's ebbed and flowed. I mean, I'd say the high water mark for Fayette County with hands, we were serving close to 100 families before COVID. COVID came and kind of, you can imagine, put a big pause in our services because it was home visitation. We couldn't do home visitation services, due to COVID for a couple of years. So we literally kind of almost started fresh. I think we had like 30 or 40 families in the wake of COVID, but we're back to about 75 now. The goal is to try to get back to 80, 90 and up, soon. But it's a constant challenge because we're constantly losing families. And so the video that you're about to see was created with the intention of trying to tell the story from a perspective of a participant. And also a lot of the population we work with, they're a lot, they're younger families a lot of times. And so I wanted it to look good. It had to look cool. It had to capture the right vibe, you know. And so we hired this group who was a brand new media group. They were still in college. I mean, they literally I think they made this in their dorm room or something. They're a legit, thing, but we were one of their first clients, honestly. But these guys showed up and to, kind of pitch their concept, and we were just blown away. They were all these young guys, and they had this idea just through a totally different lens than we did because they're all of this age, and so it was great. And so the video that they're the ones that produced the video, and it turned out really good. So I'll go ahead and just play it. Let me know if you can see and hear this. Okay. Can you guys see the video, Whitney?
Yeah.
Okay. Let me try again. Now, maybe.
Yeah, looks like.
Can you see her now?
Yeah.
Okay. I hope this works in terms of being able to hear and stuff. Let me know if you can't hear it or something. We'll stop it. But let me know, okay, if you can't
Okay.
hear it. Cool. Okay. Can you hear
Yeah.
it?
No.
No, shoot. See. Oh, I'm sorry. Can you still hear me? Okay?
I can hear
Yeah.
you. Yeah.
Yeah, shoot. I'm getting a message that there's no sound, unfortunately, on the video. You really need the sound. Shoot.
Is it Dave, is it posted on the website anywhere?
It should
Okay.
be.
Okay.
Yeah.
We can definitely
Yeah.
share it with
I was gonna say, and I can share it. I can give it to you, Whitney, and um you can share it around. I just wish I could fix it so that sorry,
that's okay. I get it.
I was worried that I was hoping that I could make that work.
Yeah.
Well,
You're muted.
sorry, can you hear me now?
Yes.
Sorry about that. My new mouse pad's got these little controls for Zoom, and I think I accidentally hit mute. But I was just saying that the video it follows a couple families, through just kind of their perspective. One of the families is a young family that actually I think the mother may be a professor at UK or something. That they're not what you would think of a lot of times as a typical family receiving health department services. And then another family is a family from I want to say maybe think it's maybe Senegal or something who have been here. They've been here for a while, so the mom speaks fluent English very well, but it follows them and their child, and just kind of we actually had the video crew go and in bed with these home visitors and get some footage. That was it was really good. Like I'll say I'll make sure to make this video, and we've got 4 short reels that are like a minute or two in length that are more appropriate for just if you're at an event or something and you're needing to promote hands. It's not really that it's something that we try to create that we could also that other hands departments and counties could use. So it's not that branded for Fayette County either. So if you're in another county and you're an AmeriCorps member who's helping promote their program, I'll send you these things or links to these things, and you're welcome to use them. They're helpful tools, for sure. It's probably the most of the hands videos and stuff that exist. It's probably the most current one that I know of. So there are few out there on YouTube and stuff but they're pretty old, and some of those they just look a little old, honestly. They just look a bit old. So anyways, what Latoya, our AmeriCorps member, what we have her do mainly is just help. She's kind of our boots on the ground and helping to do things like make routine visits to providers and referral partners to collect referrals. And in hands, we have a referral form. And again, in hands, you can self-refer. You can self-refer in hands. So what they need is essentially forms so that they can do that. And then also just information on what the program is, right? So Latoya goes out to Baptist Health and goes out to some other community partners, and she may drop off hands brochures. She might drop off, we've got candy jars and things like that have our logo and have our number and things like that. She'll deliver those, and then also in turn pick up whatever referral forms they might have, and then bring them back to our hands team later, who can then connect with those families and try to get them enrolled for services in hands. Latoya has also been great to go out and represent the health department and hands department at different community events and different collaborative things. And again, for program promotion, help spread the word about the program and help to try to generate referrals for the program and generate awareness. And visibility to try to just elevate and amplify our visibility out in the community. And so those are the main things that we use Latoya for in terms of hands. And it's we've seen a definite increase when Latoya is working with us. We see a definite increase in our monthly number of referral forms that we get back. Just simply having somebody out there to be able to promote the program and have a dedicated person for that has been absolutely helpful for us. It's definitely helped the program to grow and spread the awareness of the program. Yeah.
Awesome. Well, thank you. Does anybody have questions about hands? Okay.
Cool.
Well, thank you so much for being here. Appreciate it. Appreciate you sharing information. And yeah, thanks again.
No problem. It was a pleasure. And I'll make sure to, like I say, I'll send you, Whitney, just a link of for the videos and different things. And you feel free to reach out if you have any questions. Anybody can reach out to me directly. That's fine. And I'll put it in the chat just so you have my email. You're welcome to reach out to me directly for any hands related stuff.
Okay. Well, thank you
Cool.
so much. Appreciate it.
No problem. Thank
Have
you
a
guys.
good rest of your Monday.
You too. Take care.
Thanks. Okay, everybody. So I'm going to switch modes and also I'm gonna sorry. Switch this. We're gonna switch gears and do our timekeeping. And then we'll end for the day. So we're definitely gonna end early. But we're ahead of schedule for tomorrow as well. So we're knocking it out of the park today. Does everybody see the America Learns?
Yes.
Okay, perfect. So actually, I did look on Friday. I'm not trying to put anybody on the spot. So I know some folks had tried to, or have definitely have entered time. Does anybody want to share their experience with the timekeeping system so far?
It seemed pretty straightforward to me. I
Okay.
just entered my time and I was able to do it for the whole week, but I wasn't able to turn it in until after the like final time I clocked out.
Okay. Like the due date for the,
Well, okay, so it said I couldn't turn mine in until Thursday after I finished working because that was the last day that I had time on there.
okay, gotcha. Okay.
So I did it like Thursday after I left work. I was able to turn it in.
Okay, gotcha. Um, Craig says it's easier than last year's so far
Yeah.
returning folks, and Alina maybe feel the same.
Yeah, I agree.
Um, okay.
I thought it was pretty straightforward. The only thing I didn't like was that, like, let's say I get here at 8:05, I either have the choice between 8 o'clock or 8:15. So then I wasn't sure if I'm supposed to click 8 o'clock or just go with 8:15, even though it's closer to 8.
I would do eight,
Like,
Catherine. I
you
don't,
know, yeah.
I
So
mean,
that was the only thing that I didn't really like about it. But other than that, it was self-explanatory and it was a lot easier than last year's, I think, just because like everything is just literally right there and you don't have to worry about like specific columns. It's
yeah.
just already marked and you just do the pull down thing. So it was super easy.
Okay, good. Um, so for our new folks that are first year members, sounds like you all dodged a bullet. You didn't have to worry about last year's. We have a different timekeeping system compared to last year's. Um, I do like America Learns. I would say the same that a couple of folks have already said that it does feel just a little less clunky. Um, so if you're a first year member and you're like, I hate this timekeeping system, just think about what we've just said and how bad it was last year. Um, so this is a pre-made PowerPoint that comes from our friends at America Learns. So some of this is just stuff that they say about themselves, but I like them. I think that they are they try to be very user friendly and they try to be there for their programs that they are serving, and try to find solutions if something's not working. So, um, anyway, you all can read this later if you want to. So you've already done this stuff. You've already created a password. Everybody's in there, so I'm going to skip through this. Your homepage looks like this. Um, so the one thing I will point out here is that you can do a couple things. You can bookmark on your computer, your desktop, your laptop, whatever, that americalearns.net/KYPA, to make it easy to go to. But there's also an app that we'll talk about in a minute. And then on the homepage there, if you forget how to do something, like if we have later on, there'll be a couple of documents later in the year that you'll have to sign, and you're like, I don't remember how to do this. There's something weird that I forgot. There's this document signing training video. And then we're going to talk about progress reports tomorrow. And there's a report completion training video on your homepage. So I think that's helpful. I will, I have not added anything down here on the homepage, but if there's, as things pop up that I feel like need to be on the homepage, I'll add them there. Um, Other than that, this is what your homepage is going to look like. So If you need to request that your password be reset, you can click the reset password button on the homepage. I don't think anybody's had, if you've had to do that, you can share about it. Has anybody had to do that? Okay. So here's the app. Um, there's a training video that you can watch. This is a link. I'm not gonna play it here unless somebody really wants me to, but it's available. Um, there's, if you're an Android person or an Apple person, there's how you do it. So I think a couple folks have utilized the app. Does anybody have any tips or tricks? Do you like it? Do you not like it?
Say I use the app. I like it, except for until I had my phone set up to just I guess like automatically log me in with like my face verification. It was kind of annoying to have to type in everything to log in every time.
Okay.
But once I got that figured out, it's pretty easy. Makes it a lot quicker to put in my time sheets instead of trying to log on because I did AmeriCorps through my school last year, and I was always behind on my time sheets because I would have to get onto my computer, get onto the website, and then log everything.
Okay. Was it America Learns that you did your time
No,
sheet?
they did OnCorps,
Yeah, that's what we had last year.
and it was horrible. I hated it.
Okay,
It
so
was
see,
awful.
that's another, you all that have never had to do Encore before, we are saving you from having to do Encore. So I agree. Another down vote for Encore and an up vote for America Learns. And Encore does not have the app or anything like that. So the one thing about the app with America Learns is the plus is that you can use it when you don't have internet service. So if you are out somewhere and you don't have internet connection, you can still input your time and it will save. And then when you get somewhere where you've got a connection, it'll upload and it'll, populate and you can submit it and it will not, you don't have to like redo it. So that's helpful, hopefully for folks. So do the app. Sounds, I would if I had to do it. Okay, so most of this it's gonna go through like what it looks like on a desktop, but it's not gonna, I don't think it looks any different. Obviously it looks different because you're on your phone, but the steps are still the same. So when you get a new timesheet to complete, you're going to be prompted to do it. But just know that timesheets are due weekly. This is not different. If you're a returning member, you had to do timesheets weekly last year, so no different there. For our folks who are new this year, it just is helpful for everybody. It's helpful for you to know where you stand and how many hours you need to complete to stay on track with your time. It's helpful for me to know. It's helpful for your site supervisors to know so that we can, get ahead of any issues as far as your time if we need to figure something out. This is what the login looks like. So you'll select the timesheet. If you got two timesheets, if you forgot one or you just didn't hit submit or something, then you'll have two there. Um, your site will be auto-selected, so you don't have to worry about that. If you did not serve, then you'll click the little checkbox that says I did not serve, and then you'll go down to the drop-down menu, and these will be your options for why you did not serve. So for anybody that has already been working on their timesheet, any that are weekend is going to be just not scheduled to serve today. So you shouldn't have had any option or need to use approved personal leave, illness, or site closure yet because we've not encountered those. If you've been sick and I haven't known about it, I then I need to hear about times when you're going to be out of the office or out of your service site for like vacation days and illness days. So again, other times are just going to be not scheduled to serve today because it was either your scheduled day off or it's been a weekend. So then the rest of your time is going to be your time in, time out. And it's going to be on site most of the time. If it's teleservice, then you're going to have prior approval. And I do have a question for you all about that have completed your timesheets about your unallocated time. Can you tell me how that's looking on your end?
I didn't submit my timesheet last week, but I did try to fill it out to the best of my ability. And I would always fill it out on my desktop just because I have a desktop at my office, so I just did it there. And what it would do is after I put my time in, time out, it would not let me save the time for the day or give me the option to submit the timesheet, like unless I allocated all the time. So it would just let me, it was in like 15-minute increments you could put in for like all like the four areas, handwick, community engagement, outreach, and then training. So I just put in my little sections based on what I did for the day. And once it said that all of the time was allocated, it let me save my time for the day.
Okay. Okay. I think that's what it should be doing. And letting it, yeah. So when you're entering like your start time and your end time, then everything's going to go to unallocated time until you tell it what you did for that 7.5 or, however many hours. So that sounds right. But if anybody feels like like it's not, the math is off or something, then let me know. But that does sound right. It's got some The default for America Learns is that it wants you to take time for a break. But I think that we updated it to where you do not have to take time for a break if you didn't like leave campus for lunch. Um, but this should not, you're not going to be doing description, so ignore that. Um, these should not be, sorry, y'all, those sites, those slides should not have been viewed. Okay, these are your options for service. Hopefully they're pretty self-explanatory. It's harm reduction, health education, outreach, WIC, or hands. So if you are providing service, it means that you weren't receiving training. So today it's going to be a training time, not service. If you're providing service, it's going to be in one of these categories, whatever you're providing service in. If you have any questions or if you're confused about it, please reach out and let me know. Training, it's either CHW training or not CHW training. So the only time it's going to be CHW training is when you are receiving CHW training. Everything else is non-CHW training. We're not making it more specific than that. So last week, I would assume that you received some training at your health department. So I would assume that I'm going to see some training, maybe not for some of you returning folks, but definitely for our new folks. So today is going to be a non-CHW training time from 10 a.m. until 2 p.m. Is going to go under non-CHW training. Any questions about what you're doing week to week and you're unsure if it should go into training or service, just reach out and let me know. So here's the unallocated time. So if you take like an extended break, if you have a doctor's appointment in the middle of the day, but you come back to your site, or if you need to leave because you've got class or something like that, but you come back, then you can demonstrate that you started your day at 8 a.m., But and you finished your day at 3:30, but during that time, you had to be gone for 2 hours or something. You can do unallocated time and show that you had to be gone for some period. So as far as saving your time, you should be able to just click save after you have allocated all of your time wherever it needs to go. If for some reason you're having an issue here, please reach out and let me know. It should let you save your work as you're going. If you've already experienced this, let me know so that I can let the America Learns folks know that we've got folks having a problem here. If you don't want to save it, then you don't have to, but I would err on the side of saving instead of not. You can copy and paste if you want to, if you know that your time is the same for a couple days, up to you. If you're doing the same thing for same type of service and the same time, then you can copy and paste. And this tells you how. You can select the days and apply it and just click save and apply. And if you've done it before, it's not going to let you do it it won't let you mess it up. So you'll get an error or it'll prevent you from copying and pasting over days that you've already done it for. Here's a recap. When you are ready to submit your time, it will show you how many hours you've done for the week and how many hours you've done in each category. You will not have a fundraising category on your timesheet. It'll just be service and training. And then you'll review it to make sure does that sound right? Did you do, this one says 34.5 hours. Does that sound right for your week? And then you will submit your timesheet by signing your name exactly as it appears in the parentheses. So it needs to say your name has to match exactly that, or it will not authorize and submit. So to submit your timesheet, I do not have this turned on right now, but I did want to go over it in the event that we do turn it on. We don't do accompaniment. This is more information than you might need, but some programs will allow members to serve before they have cleared a background check. We do not do that. So the second part, though, is teleservice. If we have an event that would prevent you from serving at your site in person for an extended period of time, then we might need to require some documentation that is showing that you are, providing teleservice, whatever we decide that that's going to be. Then we would maybe turn this on where you are adding information or uploading documents to show that you're doing training or whatever the case may be. So that would this is what that would look like. So you would detail a little bit with the not accompaniment. The teleservice is going to have require or previous approval from both your site supervisor and me as your program director, and you would just talk about what you've done and submit it. So just an FYI, that might come. It's not necessary right now. So this is helpful because it shows you how many hours you have left to complete your service on time. It will you can get to it on your dashboard, on your home screen there under my timesheets, and under your remaining hours, your weeks remaining for your education award eligibility. So it does your number of hours divided by the number of weeks left. And then under that is your, does it tell us on the next screen? Sorry. Yeah, your number of weekly hours needed to complete. So that's like your average weekly number of hours that you need to get in so that you can finish on time. So you'll see this number ebb and flow based on what you're doing each week. But if you have any questions, any issues, or if you're confused about anything, please reach out. But I think that provides a good snapshot of what you need to be working towards each week as far as the number of hours you need to complete. You can look at your past timesheets that you've done. If you have a timesheet that's returned to you, then it'll be under edit and resubmit timesheets. And it'll have whoever sends it back to you is going to say what you need to do to fix it. So it shouldn't be any question about what needs to be edited. So just lastly, reminders, you can complete your timesheet on your computer, on your smartphone, on a tablet, and it will upload when you get back to an internet connection if you're using a smartphone or a tablet without connection. But you always have the ability to be mobile to complete your timesheet. So there shouldn't be any issue with ever being without the ability to get your time done on time. If you don't complete your timesheet, then American Learns is going to send you emails to complete it. They're going to remind you constantly. Those aren't coming from me, it's coming from American Learns, but I'm going to be keeping an eye on it to make sure that you're getting it done as soon as you can. Are there any questions about the timekeeping system?
I do have a question. So when you were talking about submitting the times and allocated time, where I am working mainly with community engagements, I have a lot of days where I might be like in the office in the health department from 9 to 2, but then work an event for community outreach from like 5 to 8 that same day. So what I do, like my time in is 9 a.m. and my out time is 8 p.m. and then have like the 2 to 3 hours of unallocated time listed like that, or should
Yeah.
I like that? Okay.
Yeah, because I think because you wouldn't be able to do like a second time sheet, for
Yeah,
the same
no, it
day.
won't let me like put multiple times for the same day. So what I did
Right.
last week is I just like there was one day I worked let me look at it. There was one day I worked from oh my gosh, I don't even know. But I did that. So I worked like from 9 to 2, and then I had an event from 6 to 8. So what I put is I said that I worked from 9 to 4 and just like moved that time up. But I wasn't sure if you'd prefer for me to do that or put the unallocated time. And my supervisor wasn't sure either. She wanted me to ask you because the
Okay,
way the
gotcha.
health department does their timesheets is completely different than the
Oh,
way
gotcha.
American does
Okay.
it.
What does the health department do? Like for
Well,
an
I don't,
instance
well, for
like
one,
that?
all of their timesheets have to be submitted on Friday. So where ours are technically submitted on Sunday if we do work through the weekend. I was gonna ask you about it and then talk to her and then get back to you.
Well, I mean, to be honest, I would probably do it to where like your start time was the time you start and your end time was your actual end time and do
Okay.
that unallocated time as just a break.
Okay.
But
That makes sense.
if if it gets to be confusing, we can figure out an easier way if you just have your end time be what you did last week and just make your end time. I just don't want you to miss out on your time.
Yeah.
So let's try it with the actual start and the actual end time and do that long break in the middle,
Okay.
and see if that's okay. And if it's not working, we'll figure it out.
Okay. Thank you.
Yeah. Any other questions?
Yeah, I forget if you said, but in the for lunch, if we're not leaving the site at all and we're like we packed lunch, what do we do for that time?
You don't,
Just
I'm not concerned about you like showing a break if you're just like sitting at your desk and not leaving and it's just like a quick lunch. We don't have to, you don't have to demonstrate like an hour break or whatever. You can just do like if your time in was 8 a.m. and your time out is 4, just you don't have to have any unallocated time.
okay.
Any other questions? And if you're probably going to have questions as you get going, so that's totally fine. That's what your support is here for, and it's me. So, America Learns, if you remember from the start of the day, it's a system that I can help you out with. So, even if you submit a timesheet, nothing is set in stone. So, we can always edit and fix it and resubmit it. So, if you get locked out for any reason, we can reset your password, and I can send you back a timesheet to edit and to fix and to get back on track with. So, um, okay, y'all, that is it for today.